I'll welcome everybody this evening to Wyoming Medical Wellness Center and Dr. Daniella Gerard and staff, and thank you for hosting this evening. It's been wonderful. Yeah. I'm Gail Wolfing, Executive Director of the Chamber. So first I'll go ahead and do my normal recognition of the elected officials, which there aren't any tonight, so there's that.
Jim Hastings from the Cemetery Board.
Yes, he is an elected official, you are correct.
And he's awesome.
Yeah. And he's not here right now, but he was here. And from my board of directors, Missy Bigler from Power Energy is here.
Yay!
And of course our energizers are here. We love our energizers. They're all here and they're all in red and they're fun. So I'm going to go ahead and let Daniella tell you a little bit about what she does, and then we'll go from there.
Sorry. Party music.
She wanted to start with her.
Yeah.
All right. Well, thank you everybody so much for coming. Really appreciate seeing everybody here. So, and I wanted to talk a little bit about the things that we do at Wyoming Medical Wellness Center, because we do quite a few different things. So first and foremost, we do functional medicine. We do have a couple of flyers back there that explains a little bit more about what functional medicine is and how the approach is different than traditional medicine. For those of you who don't know me, I am actually an emergency physician, and after years of emergency medicine and seeing people struggle with some of the same issues over and over again, and having seen multiple doctors and come to the ER with a lot of problems that we didn't have a lot of answers for. So I started looking into, there's got to be more to this, there's got to be more we can offer, and that's how I discovered functional medicine. So functional medicine really looks at the whole person, their whole life, and how they got to where they are today, and what the root cause of their problems are, puts everything together into a systems approach that's different than the systems approach that we look at in conventional medicine. So with the background of conventional medicine, adding on the functional medicine on top of that, I got a lot more tools that I can look at some of these chronic, ongoing problems that a lot of people end up throwing their hands up in the air and saying, I don't know what to do with this anymore. And that's where, we were with, and we are with conventional medicine. We keep trying to band-aid it, treat the symptoms, give you another pill for every ill, and then you end up without the problem being taken care of, but now with more medications that cause side effects to the point where we don't know anymore what came first. Is it a side effect, is it a problem from the original process? So functional medicine, you spend a lot more time with the patient or with the client, because I don't like to say patient, because we don't look at people as having disease. We look at that illness that we can really impact, and if not cure, at least bring under control. So it's a very different approach. It's a lifestyle, nutrition, exercise, mind-body, prayer. It's a whole different approach where you're bringing in some other tools to help your body deal with all the stresses that we put it through on an everyday basis. So that's one part of what we're doing, that's the functional medicine. And then the other part is we do aesthetics. Or as I like to call it, I like to treat people and make them better and more beautiful inside out and outside in. So the aesthetics part is the outside in, where, it increases confidence, makes you feel better. And some of the treatments actually, especially the radio frequencies that we have, it's almost like a really nice massage too. So there are fun treatments. We have 3 different machines, and one is the sculpture that does the body sculpting. It's the warm sculpting, which is different than the cool, and it has a number of advantages, one of them being that it's more homogeneous. It's quick, it's easy, it's a little uncomfortable, but really not painful, and it's a 2 treatments and done. So, and it gets rid of about 24% of the fat layer in that area, and those cells that die and are gone. So that is probably my favorite one of the machines. Then the
Maybe more
icon
market machines
is
too.
kind of the power horse. It does everything to do with wrinkles, pigment, hair removal, redness. So it has a lot of different functions. And then finally, the radio frequency does collagen stimulation. It addresses issues with cellulite and basically skin rejuvenation. And it also we have that for the face and the body. And on top of it, and if any of you want to stay, like the second part of this, if we have time, we can go play with it. We have a machine that actually can tell you your true skin age. So we take a number of pictures, it analyzes it, it looks at the sun damage, it looks at number of wrinkles, it does all its little magic thing, and then it tells you what your real age is and what your true skin age is. And one thing that I found fascinating about it, and that kind of made me trust it from the very beginning, was that it usually puts your skin age on the left side, which is your driver's side, which faces, the sun, and you don't think how much sun you get while you're driving. It usually ends up being older than your right side. So that is kind of a little tidbit. And the other thing I was impressed, I had a number of patients, a couple of patients anyways, that we've done a few treatments on, that we have seen their skin age go down by 5 to 7 years, within a matter of about 3 months. None of these treatments have a immediate result because they work below the skin. They stimulate collagen. They really address some of the things below. So you have to be a little bit patient. But they do pretty amazing work. So, and if any of you would like to do the pictures, I'd be more than happy to play with it. I love that machine. And then, so those are the two main parts, of what we do. If you have any questions at all, please, Sarah is the practice manager and Kate is my nurse, please. Ask any of us. We also have flyers that tell a little bit about what functional medicine, a little bit more detail about what functional medicine is. I'll get to this in a second, so that it's falling off my head. And, and like I said, any questions or anything, please don't hesitate to ask. That's what we're here for. We do free consultations on the lasers. Then in some of the other things which I didn't really mention, but part of the functional medicine, we do weight loss, we do hormone management, so all that is actually part of the functional medicine. So it's really nice when you work with somebody on weight loss to get them to the point where they can do the sculpture and they can do that final touches of, body sculpting. So it's very rewarding when you do that. And then finally, why am I wearing this? This is one of the best sunscreens, and actually it's a sunblock. Some of the lasers we cannot do in the summer because if there's any kind of tanning, those melanocytes, the cells that give you the tan, are active, and we don't want to activate them more with the lasers, so we can't do that. So if people do end up promising and making sure when we actually have a machine that tells us if there is any tanning, so that, again, we don't want to work on that skin if it's already activated. But this protects you, gives you that additional protection, and we have ones that goes even further down over the face, so that for the number of weeks before and after the treatment, we make sure that you wear your sunscreen on your face, but it also gives an additional level of protection. So, okay, I think that's about it.
Okay, well, I think you have some prizes you want to give away. Is
Yes.
that correct? Okay, so we'll